Hello, I'm Dr. Warren, and this is the second video I'm making about going through the CDC website and bringing you on some updates because the CDC has acknowledged and added a section for chronic Lyme or post-treatment Lyme disease. This is really exciting on one hand. This happened a couple months ago. I was made aware of it in the end of April, early May in 2022. So I'm just going to go through some of the changes and what that means, why people are really excited about it, why you should be excited about it. Also, some things that are upsetting some of my patients, upsetting some of my fellow Lyme practitioners, and I'll kind of try to walk through and keep you up to date on that. And lastly, what it means for you as someone who may be struggling with this. So if we just click on and we go CDC Lyme in Google, and then we click here, we're brought to this page, Centers of Disease Control and Prevention. There's a paragraph. I go through this in another video. We're going to go down, and there is now a section on post-treatment Lyme disease syndrome. This is exciting, if only because when my family first encountered Lyme, our doctor basically said doesn't believe in Lyme. When I listen to patients for over the last decade or so, that's the most common response we get from their doctor is, we don't really believe in Lyme. We don't believe in unicorns. We don't believe in Lyme. And that I use that term, I use that kind of language very specifically because that is what doctors say. And so when we have one of these big updates where the CDC is now saying, hey, post-treatment Lyme disease syndrome or chronic Lyme, we'll talk a little bit about those terms, it exists and it's here. So I'm going to start actually by clicking on this treatment section. And just note here that some patients report persistent symptoms of pain, fatigue, or difficulty thinking, even after treatment for Lyme disease. Thank you. So many patients who have these kinds of symptoms lingering, going on, have not been acknowledged, have kind of been kicked down by the medical system, accused of inventing it. For us personally, it was kind of a demeaning experience when a doctor basically just says, we can't find anything wrong with you. You must be in your head. And it's not real. What they really should say is, I'm sorry, we failed to find a reason. This is the best thing that I can offer you. It's a little more compassionate, but it often comes across, at least both to us and to many, many patients, with a less gentle, less compassionate tone than maybe it should. So nice to see that after years and years and years, if your doctor is telling you Lyme disease does not cause chronic problems, or it only causes a rash, it doesn't cause nerve symptoms, it doesn't cause heart symptoms, it doesn't cause arthritis symptoms, and it's not a long-term thing for some people, they're just wrong. And you can just send them to the CD website and say, some people experience this. Now, on that hand, it's very exciting. And I'm going to go back here, and then I'm going to go on this post-treatment Lyme syndrome page. This page, the fact that it exists makes people very excited. If it exists, you can fund research for it. If it exists, there will be eventually ways to start coding it and possibly getting things covered. As right now, really, it just gets diagnosed with an anxiety or some other diagnosis code has to be put on it that doesn't really fit. So we're hoping that this will spill over and people will have better care. Right now, if it's acknowledged, it will fund more research. Once the research happens, you'll have guidelines rewritten, and that's when insurance companies get involved. They'll still pretty much follow the published guidelines, but really excited to have a big website like the CDC updating data to have things like this acknowledged. Now, unfortunately, when I walk through this, they say a few things that have made some people angry. So let's just highlight a few sentences. Why some patients experience post-treatment Lyme disease syndrome is not known. Unfortunately, there is no proven treatment for post-treatment Lyme disease syndrome. Once again, I'll call this chronic Lyme. There's some big arguments over exactly what to name this. I have other videos, or I will make more videos where we discuss the nuances of naming something. I don't necessarily care really what it gets named. I care that people who are suffering with long-term mysterious illness, get taken care of and get back to their life. That's what we're going for here, not arguing exactly about what acronym that we're going to use. But acknowledging that chronic Lyme or post-treatment Lyme exists is huge, but they're basically saying we don't know what causes it and we don't know if there's a proven treatment. Once again, this is not nearly as simple as taking 2 to 4 weeks of antibiotics. Now, what they recommend is that you take the 2 to 4 weeks of antibiotics, and then unfortunately, this last paragraph is what has patients and kind of my Lyme community really excited, but also super upset. And this last paragraph I will read. Patients with post-treatment Lyme disease syndrome usually get better over time. It can take many months to feel completely well. Oh boy. They're basically saying this goes away if you just wait for a few months. And that, I would say, was not true for my family and for many, many patients that we speak with and encounter. This does not just go away in a number of months. While the Lyme community and doctors who've been fighting this fight for 40 years and even patients are excited that to have some acknowledgement, to have hopefully some research funding coming our way, the idea that this will go away by itself is very misplaced and wrong, and not what many, many people experience. If you have been treated for Lyme disease, and what they mean here is 2 to 4 weeks of antibiotics, that's all they mean, and still feel unwell, see your healthcare provider to discuss additional options for managing your symptoms. So they're saying do the 2 to 4 weeks and then just take medications for your symptoms. So if you have pain, take something for pain. If you have anxiety, we'll give you something for anxiety. If you have neuropathy, we'll give you nerve blocks. We're just going to start giving you medications for your symptoms, which is kind of what happens now. There's so much more progress on the Lyme and co-infection front than there was 10 years ago when I first jumped into this world, when my family experienced this. Couldn't go to the CDC and read about this. So very exciting news on one hand, but also to say it goes away by itself and just take medications to mask your symptoms and we don't have anything to go at the root cause of this illness is disappointing. Columbia and Johns Hopkins and Harvard and ILADS and a myriad of other healthcare practitioners have been working on, multifaceted approaches to helping heal people from Lyme. We've been helping people who suffer from this heal for over a decade. And so there's so much to do here that's just not being stated. Forward progress is forward progress. We always take that. On the other hand, we have people who are frustrated it's not farther, that they're not offering really good solutions. They're just saying, just try the best you can for your symptoms. But what this does mean to us is if your doctor is telling you he doesn't believe in Lyme, he's just wrong. And he's been wrong for a while. And now the CDC says he's wrong. So our response to, if your doctor says we don't do Lyme or we don't believe in Lyme, is, well, the CDC does. That argument's kind of over. Now we can start arguing about what to do because they're going to do just symptom management and we can talk about that. But that's really where the discussion needs to be happening now is what do you do? We take a threefold approach similar to what Johns Hopkins circles of trying to help you kill bugs, trying to help your immune system, trying to help your body recover. Other videos we talk about, things that we do to try to help people heal. But that's what the discussion really needs to be now is towards that healing process, really not arguing whether this thing exists. And now we need to worry about helping these people, not arguing about whether they're real or whether they're lying or whether they're faking their illness. They're not. Their lives are suffering. And it's progress to have that acknowledged at this kind of a level. And on that hand, it's exciting. I'm Dr. Warren. I hope you found this video helpful, and we wish you the best on your journey towards health.